I'm going to quickly go through some information that is familiar to most, if not all, and then hopefully I'll add to some extent, hopefully to your current fund of knowledge on the topic of long COVID. But I want to take the time, if I can, also to introduce our study. And our study is designed to hopefully help people who have long COVID, especially the terrible brain fog, the terrible fatigue that has been so persistent and so debilitating in people who've been affected. But before I do, I thought what I might do is just provide a bit of context to our group, the Brain and Cognition Discovery Foundation, which is here in Toronto. And we are a group that's been particularly interested in trying to help people who are experiencing difficulties with brain function. This largely is a focus on mood disorders, but we've taken a particular interest in difficulties around cognition. And what we mean by that is the ability to think effectively and productively. This has clearly become a brain capital economy. We want people to be able to participate in their community, and increasingly having a well-functioned brain economy is good for everybody. And the Brain and Cognition Discovery Foundation has been looking at not only underlying disease states that might affect brain and cognitive function, but how we as care providers and as people who live with these conditions can work together to prevent these problems and also to treat these problems when they occur. Now, I started as a researcher in psychiatry about 25 years ago. And at that time, when I started my career, I was particularly interested in depression, what causes depression and how can we cure this awful illness. And very soon after, I discovered something which was quite interesting to me, and that is that most people with depression are suffering from terrible brain fog and terrible fatigue. And what we then discovered in our research in our labs is that a lot of this has got something to do with the immune system. So we began looking at this from different perspectives. And as an organization, we said that we've got to figure out what is it about the immune system or other types of systems that can affect the brain, but more specifically, what is the relationship between the immune system and brain fog and fatigue? So then about 2 years ago, the pandemic at least started here, March the 12th of 2020. And I recall vividly, I was on a plane coming back from the Sunshine State, Florida, and the whole world was shutting down. I was leaving Orlando, supposedly the happiest place in the world, Walt Disney World. It was not happy that day. And we were hearing about this pandemic all around the world. And very soon after, we began to see what I've seen many times as someone who's an advocate for people who suffer from these problems. And that is an infection created what we call a cascade event that resulted in terrible dysfunction, terrible loss of quality of life. And I met person after person after person telling me they had brain fog and fatigue. And we said, we've got to figure out what's going on here. And we tried to build on some of the research we've done in this space for 2 decades, helping people think and helping people who are suffering from fatigue-related problems. And that's what we do with the Brain and Cognition Group. I'm based in Toronto. I wear different hats in different places around the world. But today I'm here in Toronto and speaking on behalf of our group, the Brain and Cognition Discovery Foundation. Now, what I want to do, if I can, is really just a reminder, what is long COVID? And I think that we've jumped to the gun here in the sense we've got into some of the weeds of the research that we're all interested in. And just a reminder that this is a label, this is a moniker, this is a title that's evolving, it's fluid. There's different groups around the world that have different definitions. The World Health, there's groups in Europe, groups in America, like the US government and so on. And I think that names do matter, and maybe the name will change again in the future. Who knows? We've heard conditions like post-COVID condition, post-COVID syndromes, long hauler, long COVID. I think whatever that name or that moniker ultimately settles in on, we can agree it's a common problem. It's a problem that is not yet well characterized in the sense of, I don't think we really know where the boundary is between long COVID and perhaps other related conditions. The other part about this is I think we're still trying to really understand who's most at risk and who's less at risk and what are some of the factors that influence the risk. I shouldn't forget to mention that a promising note, at least the data right now are giving us a reason to believe that if you are vaccinated against COVID and you do become infected with COVID, that the risk of long COVID might be less. Another reason why we should be really encouraging vaccination. But again, we'll see where that data takes us. But one of the observations that I've had about this area is not only the type of symptoms, which I'll get into in a moment, but how persistent and how debilitating they are. And it is absolutely awful to be trying to live your life and fulfill your role inside your home or outside your home, whatever your role is. And you're just so weighed down by brain fog, problems with focus, problems with concentration. And you're so weighed down with fatigue and lack of motivation, and you get tired very, very quickly. And for a lot of people, this is an entirely unfamiliar experience. So that itself is very traumatizing because it's quite a threat to how you recall you once were. So I don't see long COVID only as a disease or some type of manifestation. I see it as quite traumatizing to a lot of people who are used to functioning at a much higher level and are totally unfamiliar with this type of experience. Now, you've probably all heard from, this has been covered in various media outlets and various groups, that we still don't have the exact count of symptoms. I mean, right now I've lost count. In fact, there's more than 200 symptoms have been now ascribed to long COVID. And the list seems to grow and grow and grow. And some groups seem to experience more symptoms than others. We might get into that conversation. But what's become abundantly clear is that whatever, in fact, this condition is, it affects a very significant percentage of people. And those estimates have ranged from as low as 10%, which is still quite high, to 30, 40, maybe even higher percentages. So I think we're still trying to figure out what the percentage is. And ultimately, that percentage will be arrived at once we have a consensually agreed upon, that is, we have a consensus on what this condition actually is. And we have a long history in medicine of diseases that have been originated by an infectious agent. And we have a long history in medicine where we have conditions that we're not really entirely clear what the underlying pathogenesis is, but whatever it is, it's common, it's debilitating, we have to help people. And this is not dissimilar from those situations. So we move along here now in terms of the type of symptoms, and I'm not going to go through all 200 symptoms. That wouldn't be the best use of our time here this evening. But one of the aspects about this condition that really, really jumped out at us was the symptoms of fatigue. Now, I just want to say a couple of words about fatigue. Fatigue is something we all know what that means. But I can tell you, I've done this experiment. I've sat with scientists around a table, 15 or 20. It's really interesting. You get 20 scientists around the table and you ask them to define fatigue. 20 scientists give you 40 different definitions. So we don't actually have a very good definition of what fatigue is, even though we all know what it seems to mean. It seems to mean you don't have enough energy. But what does that even mean? Does that mean you have no mitochondria? Does that mean that your cells are not producing energy? Does it mean you're lacking motivation? Does it mean that the expenditure of the energy isn't worth the reward? See, we're always doing these silent calculations. Always. Every organism does a silent calculation. Is the energy expenditure worth the reward? If it isn't, then the subjective human experience is fatigue. So fatigue is really a catch-all phrase. And frankly, fatigue could mean one of about 3 different dozen things. But for now, we're just going with this rather sort of encompassing word fatigue, which for now we'll just say means not enough energy, but it's more complicated than that. We know from work we've done over the years that people who have fatigue often have cognitive problems. That is, people who have cognitive problems often experience fatigue as part of a cognitive problem. The other aspect, which is really interesting to us, is that we know that if there's something wrong with your reward system. Now, the reward system is a well-characterized location and system within the human brain that, among other things, involves the dopamine circuitry. And we also know there's different dimensions to reward, the anticipation of reward, the experience of reward. And I'll just keep it brief and say that when there's a disturbance in reward, people often complain about fatigue. And that is that when you are just not having that reinforcement of pleasure, you tend to get tired very quickly. So the point is that fatigue is not a very simple construct in neuroscience. It's extremely complicated. It involves elements of cognition, it involves elements of reward. And as we zoom into the granularity of this, it gets more and more complicated as to what is the neurobiological substrates that are subserving this. But what we agree on in neuroscience is that fatigue is not unique to any medical condition. In fact, it's one of the most common reasons people visit healthcare providers. In other words, this is what we call transdiagnostic. It's seen across many, many different conditions. That makes it complicated, but also provides an opportunity. And the opportunity is that if it cuts across all these different conditions, maybe we can learn from some of these other conditions and we can copy and paste that knowledge into the area of long COVID to shed some light onto what's causing the fatigue in this particular condition. Now, I'm going to say a few words about the cognitive dysfunction. This is an area of tremendous interest to our group, hence the name of our organization. And cognitive dysfunction is, again, sometimes hard to fully appreciate how complex this is. Now, many, many people will self-report cognitive problems. Others, in fact, will not report any cognitive problem, but when we sit them down and do some pencil and paper tests or tests on a computer, they exhibit some fairly significant cognitive problems. In other words, we don't take for granted that a person's self-reported cognition maps entirely and identically onto their objective cognitive function. Now, for those, we have people joining us tonight from many different backgrounds. I just want to maybe speak to what I call the atoms of cognition. In other words, if we take cognition and we disaggregate it into its atoms, what we have is problems with memory, problems with paying attention and focusing ourselves. People often have problems with processing speed, that sort of Pentium chip in your head. And others have problems with what we call executive functions, which is the ability to organize and plan your day and plan your activities and be able to do what we do as humans. It's that software, that complex way you orchestrate your mind and your day and your behavior. So cognition is incredibly complicated. And then we started to hear about this problem with long COVID. And we heard about it in self-report. We saw it in objective report. We saw it across the different atoms of cognition. And we saw this persisting. And we started to think this is interesting. We wonder, in fact, if this is going to be a common problem. It turns out it was a common problem. So here we have long COVID, and you all been keeping an eye on the numbers that we keep hearing from Hopkins Public School, School of Public Health, and so on. The numbers being estimated by the World Health Organization. This pandemic has really originated one of the most common chronic diseases we have in medicine right now. If you just start doing the mathematics, if 10 to 30% of people possibly have this problem. Now, we've got a wonderful team at the Brain and Cognition Discovery Foundation. We've got folks, in fact, who are working on more the application of our knowledge. Others are doing more knowledge generation, working in the lab. Others are curating the literature and so on. Most of the team members were involved in this analysis, going through all the papers we could find, painstakingly going through papers, trying to find out what are some of the common features of long COVID. We know there's up to 200 symptoms plus, but what are the most common features, and what are the features that people most often complain about, and which features are most often reducing quality of life and function? And it turns out what we discovered is what others have reported, that it was fatigue and cognitive problems. So we said, aha, if fatigue and cognition, now we don't think they're the only problems at all. There's over 200 problems in long COVID. But if fatigue and cognitive problems are so darn common, so debilitating, reducing quality of life, why don't we start with trying to help people by targeting these symptoms? And at the same time, let's try to figure out what's going on underneath the hood. Let's try to figure out what the underlying neurobiology is here. So then we started getting our heads together. We were kind of marinating these ideas for a while. And we started thinking, we need to have a treatment that could help people, but at the same time, we need to figure out what's going on. Now, my view strongly is you can walk and chew gum at the same time. You can look at what's causing this problem and also, in fact, begin to figure out how to treat this problem at the same time. Now, in a perfect world, this would be a very easy syndrome. Easy, we'd be able to sort it out in 24 hours, come up with the entire disease figured out, and voila, we have the information we need to design the precise treatment for this particular condition. Well, it doesn't quite work that way. And I have a long experience with treating depression. And we are in a very similar situation, depression, trying to figure out how to treat this syndrome. We still don't understand the underlying disease state. So we started looking at the toolkit we had. And about 12 years ago, 10 years ago, there was an antidepressant that came on the scene in our lab. It wasn't yet available. It was very much an experimental medicine. It's now commercially available in Canada, the United States, around the world. And there's an antidepressant that was different than other antidepressants. It's called an antidepressant, but I don't really like that word because it's kind of a Swiss Army knife. Most of our antidepressants do a lot of things rather than just treat depression. In other words, you probably all heard that fluvoxamine, which is an antidepressant, has been shown to help people who've been acutely ill with COVID to prevent, for example, decompensation while they're inpatient in hospital. So using, in quotes, an antidepressant to treat some of the very serious manifestations of acute COVID. And again, that's not because they're going through a psychiatric problem. It's because the drugs that we have in psychiatry, they have to have a name. Health Canada and FDA demand we give them a name, but they're like Swiss Army knives. They have many other effects. It's no different than aspirin. You use it for many different purposes. So this antidepressant was different because this antidepressant behaved as an anti-inflammatory drug. In fact, it behaved as a COX-2 inhibitor. It actually behaved as a drug that modulates the immune system. And that was interesting. We saw that in some of our laboratory work, and then we started to look at this in some of our cognition lab. And what we discovered was this medicine could improve cognition in people, independent of its effect on mood. It's an antidepressant. That's not what we're talking about. This is a drug that can help your cognition. So much so, we developed this in some of our experiments. And what we found is that this drug can help cognition in a way that was quite significant to patients in helping their day-to-day function. So about 5 to 7 years ago, based on some of the work we did, that the FDA in the United States approved this drug for its pro-cognitive effects in people affected by depression. But again, I'm talking about just the pro-cognition effects. And then in our lab, over the last 3 to 4 years, we discovered something else. Along with helping cognition, it helped motivation and reward. People felt less fatigued. So we thought, this is really interesting. So here's a medicine that can help fatigue, help reward, help motivation, improve cognition, and at the biologic level, it can help inflammation. Now, we don't know what causes long COVID. We don't know what causes the fatigue and cognition, but we've got, I think, firm ground to hypothesize there could be some aspects of immune dysregulation playing a role here. So we wanted to design a study. Now, the study is, of course, testing a hypothesis. We can't guarantee it's going to help anybody, but I wanted to give you just conversationally the background to how we arrived at this idea. And so our study is taking place. You can see some of the information here. This is the contact information. Now, I haven't done a recent search on clinicaltrials.gov. I haven't checked in the last month or two, but last time I checked, this is still the only study quite like this that's aiming to use a medicine that's typically in the toolkit of psychiatry, but this isn't a psychiatric problem. Long COVID's a multi-system problem. And we're taking a medicine that has been well established as benefiting cognition, helping motivation and reward, and has an anti-inflammatory effect. We thought this is intuitive. Let's see if we can try to help people in this particular way who have long COVID. So the contact information here, we're doing a study, it's in Toronto. Much of this can be done virtually. This is, I suppose, one of the legacies of COVID is that we've really gone very virtual in our studies. Back in the old days, you had to come to the clinic every week for 8 weeks, and we would be with you for hours on end and this type of thing. But now we do a lot of this is all virtually. So it's very easy. I think it's much more user-friendly and obviously much more efficient and respectful of people's time and all that kind of thing. And what will happen is that if you've had if you have a diagnosis of COVID and you're experiencing features of the condition that we're describing as long COVID or post-COVID condition, whatever the name is we're going with, and you have this problem, you could be eligible for our study. And what's going to happen is that you're going to be randomly assigned to either a placebo, which is supposedly an inert substance, a substance that doesn't have any known medical effect, but we also know placebo helps people, or the actual treatment itself that we're interested in, that being 4-deoxetine. And we're really interested to find out, does it help brain fog? Does it help fatigue and motivation? And we're also looking at other aspects as well in terms of general well-being and quality of life. And of course, can it help people function better in a way that they're much more familiar with and certainly much more satisfied with? We have a great team. If you think that you might be interested and potentially eligible, you can call the number that is showing here right now. You can also, in fact, go to the contact email that's called longcovid@bcdfoundation.ca. I'd also encourage you to go to our website. You can see the URL there and learn more about the study as well.